Many different reasons can cause a drop foot. Given the ability to test these nerves electrophysiologically with a NCV test with a neurologist, and also with testing that I have in my office that was perfected down at Johns Hopkins, I'm able to identify those nerves that still have life in them. And for those nerves that have life in them, I want to regenerate them. So some of the things I do is as simple as a decompression. A decompression you would liken to going to a wedding, and at the appetizer area you've eaten too much and you want to eat dinner. So you open your belt. So it's the same idea. And I open the belt to allow the nerve to expand. Or in some instances, the nerve is damaged. So I'll use a microscope and I will open up the outer covering of the nerve and find the inner fascicles. Now fascicles to most people is a word that's foreign, but everybody's familiar with telephone wire. The outside of the telephone looks like a round wire, the inside looks like hundreds of wires. Well, that's what a nerve looks like. Except those nerve bundles, or there are little bundles in there with nerves in them. And we can identify them on an operating microscope and release some of the constrictions that occur. In addition, we have the ability, if a segment of the nerve has been damaged, to cut that segment out, and now we have nerve grafts that we don't have to harvest from you, therefore we don't have to sacrifice a healthy nerve. We can take a cadaver nerve that's been treated, it's allergenic, so it's not going to cause you a harm, and I can sew that together using what we call nerve grafts and nerve conduits.